Thank you all for coming to our DSPD Provider Quarterly Meeting. I'm Marcy Platt, and I am filling in today for Angie that couldn't be here. Just to kind of give you an outline of what we're doing, we're going to start with some announcements and information, have a couple people present some training items, and then we'll move on to a question and answer session at the end. So if you have questions throughout the meeting, feel free to put them in the chat, and we will get to them at the end, so we'll be holding questions until then. There's less than a month to fill out the State of the Workforce, formerly known as the State Staff Stability Survey. The goal of the survey and the resulting data helps DSPD and the legislature examine workforce challenges, identify areas for further investigation, benchmark workforce data, and measure improvements made through policy or programmatic changes. All data is collected by NCI and reported in aggregate. DSPD will never see any specific information for specific providers. If you haven't gotten an email about the State of the Workforce Survey or have questions, you can email Shauna Ayers at sayres@utah.gov. We'll post that in the chat. If you have gotten the email, please complete the survey by June 30th. And thank you in advance for helping to complete the survey. It helps us be able to improve our workforce conditions for those who depend on and those who serve the disability population. The Institute for Disability at USU is doing a survey. This survey is about sexuality, relationships, and people with disabilities. They are hoping for responses from this survey from adults with a disability, family members, or service providers. We will share the survey link in the chat, and if you're interested in taking it or sharing it with families and the individuals you serve, please do so. Circle of Friends is a recreational and social program developed for people with multiple disabilities and some degree of hearing loss. Their goal is to help support opportunities to develop independent living and social skills, help people participate actively in community life, and decrease isolation by socializing with others who use sign language while having fun. If you think this group might benefit any of the people you serve, you can learn more at Circle of Friends, and we'll post that in the chat as well. SCE in-person visits will resume. The only exception is if there is a COVID-related reason that an in-person visit can't take place. We're currently in the process of working to redo the DSPD website, and we want to make sure our website is accessible and user-friendly for everyone that uses it. We have a survey you can take to let us know about your experience using our website, what you like about it, and where there is room for improvement. And we will post that in the chat as well. And we wanted to take this opportunity to mention the work of the State Behavior Review Committee. The individuals on this committee have dedicated their time, energy, and experience to help enhance the behavioral services available to those with some of the most challenging behaviors. So Mark Taylor, Matt Elcock, Megan Mickelson, Sandy Smith, and Shawnee Collins are all regularly participate in reviewing behavior support plans with some of the most intrusive interventions. Their expertise is invaluable and has already made a difference in how we provide services to people at the USCC and in the community. If you have questions about what should be submitted or need to submit a plan, you can contact Jamie Withrich, and we will put her information in the chat as well. We have some changes in DSPD staffing, so I'm just going to give you the names and where they are working. Anna Dees is joining the intake and referral team. Heidi Johnson is joining Mel's team in finance. Amanda Marin has joined Becky's team in contracts. Chad Migley is the new business analysis supervisor. So he works for Rick Burrell and also took the position that was Rick Burrell. Sandra Salazar Hernandez has joined Jeff's team. Tenzin Sopa is on Mel's team, and Brianna Salazar is on Les's team. So I'm going to turn the time over to Mel, and she is going to go over changing service dates when providers submit billings.
Thank you. All right, so it's that fun time of the year. It's closeout. So we're going to talk about closeout and also some of the billing dates where we've been receiving a number of inquiries. So those are the two topics I'd like to share with you today. So let me share with you our slides. Okay, can you see that now? Okay. So the two topics is the closeout and the billing. Let me just 1 moment. Okay. So on the closeout, many of you, if not all of you, might have received that letter regarding the closeout. There are 3 important dates there that I'd like to emphasize today. Make sure that you submit majority of your outstanding invoices by July 6th. I know there's just a couple of days after July 4th, but if you can encourage everybody in your work group to submit those, especially those that are prior to June, if you can submit those on or before July 6th, that would really help our team, especially the payment techs or the payment specialists. And then the last day to submit the billing is July 11. And anything that we receive after July 11, we will be processing those by September. Anything that is not submitted but is a qualified invoice or 520, make sure that it is included on your final aging receivable. The final aging receivable is due the 17th. That is the day that whatever you submit to us is the amount that we will use to accrue. If it is not part of the accrual, we do not guarantee payments when we start processing them in September. So those are the 3 key dates that we would like you to be aware of, and that is included on the closeout letter that was sent last Friday. Okay, to help you transition from where you're at to meet all these deadlines, majority of you, I'm sure, is familiar with the provider payment, which is available in UPI. If you run the report every single day or every week, that is an on-time, real-time information. And this is one of the examples. So you have by client, and under each client is by service code, and then by month. So right now, you should have one up to from July through May. Anything that is missing payment is 0. So when you go into that report, it says 0, that means that we haven't paid you. And then it says, if the cell is blank, the service code is not on the plan for that month. So if you go through this report and you know that you have served the client for a certain month for a certain service code, but it does not show that you've been paid, please research those, because if those are valid, if there's a valid service that was rendered, research those and submit those to us. And the next slide, this is the aging receivable. The minute you submit everything to us, and then we paid you, you go back to the previous report, which is the providers, this report right here, the provider payment. Once you submit the July, by July 11, you'll get the payment run the following week. Anything that is not paid but are qualified expenditures, please make sure that it is reflected on your aging receivable. And there's a liaison from our payment specialist group that you work with. If you have any questions, please feel free to work with them. If we do not have any outstanding billing at the end of the fiscal year, we would appreciate if you can email us and let us know that that is the case. All right. And then the other one that I'd like to discuss with you today are the billing dates. We have been receiving a lot of denied claims from Medicaid because of incorrect billing, and we have received a lot of inquiries from you as well. So we would like to go over the billing dates. So what are the correct, how do you reflect the correct billing dates? For a hospital or nursing home stay, if a client enters the hospital or nursing home on the 8th, this is just an example, on the 8th of the month, and then returns on the 12th, the provider would need to split the billing days. One would be 1 to 7, and then from the 12th to the 30th or the 31st. So even if you bill the correct number of units, but then the dates is from the 1st to the 31st, Medicaid will deny the payments. So please reflect the correct number of units within those dates. And for monthly billing, if it is me, you use the 1 to 7. As long if it is a monthly, we would recommend you use the first half. You can also use the second half, as long as the dates are not the dates that the client is in the hospital or the nursing home. Now, when a client passes away, the provider can bill up to the date prior to his or her passing. For example, the date of death is the 27th, then you can bill up to the 26th of the month, but not the date of death. And then the jail time, it follows the same principle as the hospital or nursing home, which is you cannot bill the 8th, you can only bill up to the 7th.
Can I ask a question?
Sure.
So on the hospital stay, we've had a situation where we had a client who was in our day program the entire day. They had a situation come up later that evening, like at 9:00 p.m., and they were taken to the hospital, and then they were admitted into the hospital for a situation unrelated. So we did provide them services during that day, but they also went to the hospital later that evening. Are we not allowed to bill for the services that were provided earlier that day?
That is correct. I know that you provided the services, that's a Medicaid rule. So for example, if the client came back as well, nighttime, 1 minute before midnight, you can bill even just 1 minute. It's not a rule of the DSPD or DOH, it's a rule of Medicaid.
Okay, thank you.
You're welcome. So now, these are the things that happens using an incorrect dates. When a hospital, okay, I'm sure you're familiar already with the 365 days threshold, which means that if there was a mistake made on anything at all, we only have 365 days to make the corrections. Anything prior, after that, even if we scream, even if we make the correction, Medicaid will not reimburse us. So this is one example, and this is the most, I would say, frequent that happens. Hospitals can bill Medicaid beyond the 1-year limit in place for waiver services. So if the provider sent a billing with the incorrect start and end dates and got paid by the DSPD, and then later on the hospital bills Medicaid more than a year later, Medicaid will pay the hospital and takes back what was paid to the DSPD. This means that the entire amount paid for all the service codes for the entire month will be a payback. This is one example. A provider submitted only the RHS billing for a client from the 1st of January to the end of the month for $7,500. Medicaid paid RHS billing on March 1st. A year later, more than a year later, the hospital bill is sent to Medicaid, showing the client was in the hospital from the 1st to the 15th. Medicaid will pay the hospital and will take back the entire $7,500 initially paid to the SPD. And since this is after the 1-year deadline, the SPD will process the $7,500 back from you, the provider, because there is nothing else that we can do to make the correction. So it is so critical that you know the whereabouts of your clients. If they went to the hospital, make sure you don't bill for that first day, because we don't know, but you do know. But the only time we would come to know is when Medicaid takes back the money from us. If it is within 365, we will work with you. But if it is beyond that, we have no choice but to process the payback. Now, I know that there's a lot that maybe we don't remember. So if you have any question at all regarding billing dates, you can call Deanna, and this is her phone number. And if you have any closeout questions, this is my phone number. All right, I know if you have some other questions, we can answer at the end of the training. Okay, that's all for me.
Thank you, Mel.
You're welcome.
Next, we will move on to Camille is going to talk to us about affordable housing and services.
Thank you. Let me just get my screen up here. Is everyone able to see that? All
Yes.
right, great, thank you. So today we're going to talk about just affordable housing and services in general and the roles that they play with, because I know that the providers work a lot with the housing authorities. So what is integrated housing? Housing in which a person with a disability resides or may reside that is found in the community, but it's not exclusively occupied by a person with disabilities. So individuals with disabilities, like individuals without disabilities, should have choice and self-determination in housing and in healthcare and any related support services that they receive. And one of the reasons why affordable housing and services is so important and why together hand in hand they need to be they are so important because without services and the housing component being affordable housing, some people would not be successful living in the community in an integrated setting. And that's why it's so important. And we just feel like the importance, I mean, it gives people options and individual choice. It improves their health. We're finding more statistics every year that prove that it does improve their health. It helps give them independence. It gives them stability and security. It's fair. It gives them equality and equity. And it's also in compliance with the setting rule and our strategic plan. Health services research is now showing that supportive housing, along with combined affordable housing with intensive services for high needs group, saved an average of over $6,000 a year per person in healthcare. They're finding that 23% of people had less days in the hospital. Less than 33% had less emergency visits. Less than 42% had less days in a nursing home. So those are some pretty fair numbers, I think, that we're finding. Intense services can include help finding housing, working with a landlord, physical and behavioral health care, and help finding employment. With HUD has programs that serve as an important resource for affordable housing opportunities for individuals with disabilities. And that's also including individuals who are transitioning out of or at risk of entering institutions and other segregated settings. And of those programs, the most common are housing choice voucher. This is one that is portable. It moves with the person. And they get to choose where they want to live in the community. Another common program is project-based vouchers. This rent subsidy is attached to the unit. It's not portable. It stays with the property that the person is applying to for a unit to live at. And then there's also the mainstream non-elderly disabled vouchers, a family that includes at least one person with a disability between the ages of 18 and 61. This mainstream or non-elderly disabled program, it functions, the regulations and policies are the exact same as a housing choice voucher, formerly known as a Section 8. They function the same as far as policy and regulation go. The only difference is the criteria to qualify. And then you also have public housing. Public housing is getting less and less because they're just not getting as much administrative costs that housing authorities are reporting back to us. And so they're selling their public housing. But for those that are still around, they are for eligible low-income families, elderly, and persons with disabilities. Just with the housing choice voucher alone, they have seen reduced crowded housing, homelessness, and frequent moves. The study shows that vouchers reduce the number of families living in crowded housing by half of the study for those that did not have vouchers. It reduced homelessness by 3/4 versus the ones that did not have vouchers. It also reduced the number of moves over a 5-year period by more than 1/3 with those that had vouchers. So again, we're seeing in studies as years go on, the success that people are having, especially individuals with disabilities, giving them more options in the community. What are the keys to success that we're finding? When I talk to providers and I talk to support coordinators, there's a lot of different areas where people are saying we're running into some barriers. But I will say success is needed. And the reason being, and I love this quote from the Housing Virginia, decent affordable housing reduces stress, toxins, and infectious disease, which leads to improvement in both physical and mental health. Affordable housing also frees up funds within families' tight budgets to spend on healthcare and food. I think the keys that we have seen and that we've heard back are learning housing terms, programs, and their processes. And one would say, well, how do I learn the verbiage or their processes? Their websites are a key component to where you can learn a lot about their programs, the different programs, and the criteria, the demographics, and their processes on what you need to do to get onto those programs or to help people get on them. Follow through is always important because sometimes it's not always going to be immediate, especially if there's somebody that wants the option to move into the community and wants a portable voucher, because that is probably one of the most popular housing programs, and they can be on a wait list for some of these programs. Some people will tend to go to a project base or a property that has subsidy attached to it, even though it's not movable with them, but they can still have services brought into them if they wanted supported living brought into them, because they're getting the same subsidy. It's 30%. They pay 30% of their income, and then the property pays the rest. So they're starting to go spread out a little bit more and get more familiar with some of these other programs so that they can get subsidized rent, because rents are so high in the community that we are in. Update information with the housing agencies. Make sure, or properties, if you're applying at properties or if you're applying at housing agencies, make sure if somebody's mailing address changes, make sure you're updating that with the housing agency. If they have an online system, you can usually go in online and update that information directly online. You can also, some of the housing authorities offer a waitlist update form. So make sure you're updating phone numbers. I've heard some providers say that they go in quarterly and update the applications for those that they have helped apply for these programs. And it helps them because they feel like they get pulled faster, because if it's constantly updated, and if they're going to pull from a system and they know that this application has been updated, this one they're going to have to send out an update to, I can see where it would help. So I think that's a key component. And I think one of the biggest things is communication is one of the biggest barriers that I'm hearing between providers, support coordinators, and housing authorities when we meet with them, and this is the barriers they're saying, is that they need to communicate with them. And when you're moving someone from a house to another house, and if it's because of an emergency, housing authorities understand that there's going to be emergencies, and they are more than willing to work with us or work with anyone that is helping or advocating for an individual. But they're just asking that everyone please communicate with them. That is one of the barriers they're seeing. I would say communicate with the recipient and inform them when moving them to another housing setting. So if they're in a residential setting and they're utilizing a voucher in a shared housing setting, make sure that you're letting them know if you're moving them to a different kind of setting that they can't or can still be utilize that voucher, that they're understanding, whether it's the person, their guardian, they're understanding if you move them to a certain other setting that voucher can't be utilized in, that they understand that they're going to lose that voucher. Some people have been on vouchers for years, and it takes years to get them. So we just want to make sure that that is being communicated to the person receiving the voucher, the recipient of the voucher. And review with support coordinators when the person is receiving housing assistance as well, and let them know what portion the voucher covers and the portion the client pays, and make sure it's listed in the budget somewhere. If it's your PCP, whenever you're talking with the support coordinators, make sure they're understanding that the person is on a housing choice voucher, what portion that voucher pays and what portion the client is actually paying. I talked to a lot of support coordinators say they are not aware that the person is even receiving a housing choice voucher subsidy. So that is another barrier that we're seeing. Also, when it comes to using certain terms, when we use the term group home in the housing community, the meaning is different than it is for the group home term in DSPD. So one suggestion is when you are talking with housing, and if you do have someone going to an orientation or that receives a voucher, and they say, well, I'm going to use this in a group home, the first thing that housing has reported back to us is they feel like that's, oh, you can't utilize the voucher in this setting, because they think they're going into a setting of a person living with 12 people or more, because that's what a group home on their end means. So it's very important to use, I would use the verbiage shared housing and not the term group home when speaking to a housing authority. If you have somebody that's going to be in an RHS setting that's going to be asking for reasonable accommodation, to use that voucher in a shared housing setting, they should understand that this is it is something that they can request as a reasonable accommodation. So special housing types, shared housing is the word to use, letting them know that they're just going to be living with unassisted or assisted people, you know, depending on how many people in that household might have a voucher, but they can live with unassisted people and still get subsidy. So supportive services is really a key. Housing choice vouchers can and are allowed through reasonable accommodation for a person to live with a live-in aid, at the participant's choice of who they want to live with them, or the ability to rent from family if it's due to a person's disability or their need. A person may receive supports and rental subsidy. I think although affordable housing, I like this quote as well, is part of the solution, some people may need their housing coupled with supportive services to maintain it. For instance, service providers can help people with mental illness pay their rent on time and understand the rights and responsibilities outlined in a lease, or can make sure people with chronic illnesses manage their diet and medicine properly, which can keep them out of hospitals or nursing homes. That is, I think, right in line with what great services you guys provide to the individuals we serve. And without that, they wouldn't be as successful. So I just wanted to share that. Mandy is going to go over what the housing team does, and also this public notice that I'm sure all of you probably have heard, but are excited, if not, what it is saying. So I'll let Mandy take over from here.
Well, I'm excited about the public notice. Thanks, Camille, because it's been years and years and years since it's been open. I do want to just address one question that was in the chat. Denise, did I answer your question correctly?
Mandy, is that somewhere? I'm not aware of that. So if that was a finance question, we normally don't pay that day, whether it's a state fund or Medicaid. I'm not aware of any that we allow that. Unless you are aware of something that I don't.
Oh, sorry, I think I'm confused, and maybe we're thinking about a different question. I don't know.
Or maybe
Denise. For my question, like, how do we even find out if they have a voucher? So my question was, is there any way to link the two systems so we would know that they have a voucher?
So there's not a way to link the two systems, Camille, and I do send out like little surveys to the providers and they can relate to us who is on a voucher, and then we'll go into use steps and put it in there. But it's under, I can't remember, it's the financial portion or the resource portion, but if you go in there and look, the people that we know of that have vouchers will be in there, and you're welcome to add it in as well. I would say the best way is just to ask if they are on a voucher. I mean, that's a hard question. Camille might have some more, I don't know, but.
We did send out a survey to individuals wanting to report who they had to providers. Of those that responded, there were 15. And we went into, and use steps. The support coordinator can go into the financial screen under assistance. And that is where they can put that they're getting housing choice vouchers. There might be a time in the future that we might be looking at something in the future that might work better with an area where the support coordinators can see that. But the best thing is just communicate together. If we're working with somebody and we know that they're on a voucher, that's where we're putting it, is under the financial screen, under the assistance tab, under that financial screen. I hope that answers your question.
Okay, thanks, Camille. Okay, so I'll go on to the public notice. So the waiting list for the housing choice voucher or Section 8 is open for Housing Connect and the Housing Authority of Salt Lake City. So you go into the affordablehousing.com and that's where you apply. You just need basic information like the date of birth and their social and their income. It's a fairly simple application. So there's that. And then Camille, do you want to go on to the next slide? And then I just quickly want to go over what the housing team does at DSPD. So we help families and individuals and their support teams with resources and sometimes direct access to affordable housing. Usually we work with a lot of individuals on the wait list and the intake team and individuals that are in services. We work with a lot of community organizations, and we really strive to build those strong relationships within the community so that we can have access to their resources to help the people that we're working with. We also will do a needs assessment on any referrals that we get to see what their housing needs are and if they align with any special programs or any special type of housing that's out there. And we also help with fair housing and civil rights and just to discuss the law and yeah, that's it on that one. And then we provide training to intake waitlist and DSPD employees quarterly. It's our housing table talk, and we just go over barriers that we see. We have lots of special guests on there, and if anybody has ideas of what they want, we're open to suggestions. And that is it. Yes, the wait list is combined. So if you apply for one, then you just apply for both.
Okay, thank you. We have one more presentation. It's Bryn and Tamara. Are you? I guess they're next.
Thanks. Yeah. We're talking about some person-centered planning, competencies and tools today. As an introduction, we'll get some slides up here in a second, but I'll just start with a quick announcement. Great to be with you. I think that's first. Hi, everyone. The announcement is that Utah State University has opened registration for the Customized Employment Training Program. That begins on June 20th. The customized employment training is 80 hours. It's conducted over a 12-week span. It includes experiential learning, classroom time, and significant technical assistance and supports for the staff that go through that. In order to register for the customized training, you need to first have that basic ACRE employment specialist certificate and be employed in a community rehabilitation program or provider through vocational rehabilitation. We will share a link to register in the chat if you are interested. And we'll get right into it. So we've said this before, we're going to be spending time in the past and today and in the future discussing person-centered planning, what competent and quality person-centered planning looks like as well. Much of the reasoning started with the settings rule, but I think it's transitioning now to just general requirements and looking for those opportunities to improve and utilize best practice. Providers engage in person-centered planning as part of that support team throughout the year, certainly, and are often tasked with implementing those strategies day to day. In the time we have today, we're just going to go quickly to introduce that second person-centered planning competency. We'll talk more about in detail later and share a resource. Go to the next slide. So these are our employment and inclusion value statements as a division. Connecting today's training on person-centered planning back to these statements, we see some connections in all three values. First, that quality person-centered planning places the person as the expert, focuses on community connection and community access, and prioritizes competitive integrated employment as that first and preferred outcome for everyone. Employment is one of the main ways people explore interests, make those connections, and hold valued roles in their community. It's not the only way, but it is one. Okay, listed here are the 5 competency domains for staff who facilitate person-centered planning. If you've been in the last meeting, we talked about these last time. These are published by the National Center on Advancing Person-Centered Practices and Systems. We'll give a link to that general guidelines about the competencies in the chat, and a plain language version that describes the competencies in a more accessible way. Again, we're going to talk about that second competency today and in more detail at the next quarterly. Okay, as an introduction to competency 2, quality person-centered planning that cultivates connections inside the system and out. So it's both. That competency first understands that the system and the supports understands that system and the supports a person may choose. Those choices look different depending on each individual and family situation. Those choices of services within the system could be things like healthcare, social services, recreation, faith and spirituality, interest-based community or volunteer organizations. And I think the group earlier talked quite a bit about housing as a perfect example of some of those resources, and other options that I didn't list. I think it's important to point out as you look at the list of areas in this competency that choice in services is just the first part of that competency. Person-centered planning is much more than just a choice in services. Quality person-centered planning applies the ideas we discussed last quarter around culture, identity, and language. It's also discovering existing connections within the community that matter both to the community member that they're connecting with and the person with a disability. And then involving that support team as much as possible, really, but as much as needed, right? To make those connections meaningful to the person. Person-centered planning tools can help us to understand what's meaningful and valuable to the person, so we're making the right or the most appropriate connections. Again, this is just a quick overview. We're going to talk more about each of these areas in the future. So I think we're going to turn it back to you a little bit here. You're the experts on what is currently happening day to day to build those connections between people using services and with their communities. We know that these efforts have been a focus as you're moving more into the community as health restrictions change, maybe also changes you want to make as an organization based on wanting to focus on that whole person, their interests, their daily schedules, their friends, their desires, etc. We have a link which we'll add to the chat. Feel free to follow this link as I quickly describe a couple of questions that we have for you. You can answer the questions also in the chat if you prefer. And you can see the question up there. We'll split it into 2 on the form. Just as a reminder, anyone and everyone on this call can respond, whether you're a direct staff, an administrator, or in another position. The answers can be anonymous, or you can add your contact information, or maybe even put your provider name in the response. The questions we're asking are very basic. And again, we split the one that's on the screen on the form into 2 or 3. You're welcome to look at that as I'm going through. But the first is, what strategies do you use to help people connect inside the system? So some of those examples might be, excuse me, connecting with other people in services or on the wait list, connecting with people in your organization or other state agency partners. The next question is, what strategies do you use to help help a person to connect with their community? Those examples are things like friends, coworkers, mentors, peers, interest-based community groups, volunteer opportunities. And I think that's really just a short list of the options. The third question there is just kind of a catch-all. If you feel like there's something that you need to add to this that isn't included in those two questions. And then if you're willing, we'd appreciate the chance to talk with you more in detail about what's working for you, discuss your strategy or strategies, depending how many you put in there, and connect some success stories and talk about that progress. We want to know from you what works, and we want to talk in the next quarter about those best practices and cultivating connections, and what person-centered planning tools can be used to help learn, what interest-based connections each person would want to seek, and really plans for how to do that. For time today, we were going to read some of the answers in the chat or look at the form. We won't do that today because I want to give time to Tamara so that she can introduce a resource we have that talks about some of those strategies to connect with the community. Tamara?
Hello and good afternoon, everyone. I want to introduce a new resource called Community Integration, Strategies and Recommendations. We will put the link to the document in the chat if we have not already. This resource consists of 5 activities to guide support team members, advocates, and/or professionals like direct support staff, job coaches, and educators to support people with disability to meaningfully connect with their communities. And as you're reviewing the document, pay close attention to the 5 activities because we'll go into more detail in the next slide. Did we add the document in the chat? Sorry, give me a second.
Go ahead, Tamara. We'll add it in the chat.
All right, thank you. All right. Like I said, as you're reviewing, just kind of pay attention to the 5 activities. As professionals, there are still challenges and barriers to connecting a person with disability to their communities. Most often, a person with disability are excluded from social interaction, community participation, leisure activities, and employment because they lack the support or opportunity to engage with their community. The community integration document provides suggestions, recommendations, and strategies to engage and support a person with disability to overcome barriers to community integration and inclusion. Next slide, please. So let's take a closer look at the community integration strategies and recommendations. It begins with a brief introduction of the document to support team members, advocates, and other professionals who are supporting a person with disability to connect with their community. A definition list was created to provide context and common language for anyone who may not be familiar with community integration. The definition list includes words like community, natural supports, and informed choice. We've also included tips for facilitators in this document. Throughout this guidance document, there are references to a facilitator. A facilitator is a person who is responsible for leading a discussion or activity. For example, a direct support staff is a facilitator in developing a community map with the individual or the family. These tips reinforce inclusion and full acceptance of the person as you are supporting them to meaningfully connect and engage with their community. Your role in supporting a person with disability to fully participate in their community is valuable. The 5 activities was created as a guide and recommendation to support a person with disability to work, live, and to fully be part of a community life. Each activity provides potential roadblocks to helping a person integrate into the community, and then offers strategies, ideas, and ends with a thought exercise for the facilitator at the end of each activity. So let's quickly go over each activity.
Hey, Tamara, I'm really sorry, but we're actually at time and we're going to have to cut you a little bit short. We are gonna make sure that we have an opportunity for you guys to finish this training at a future meeting, because this is really, really important content. But we do have some questions that were in the chat that we really need to get to before we wrap up. So I'm gonna hand it back to Marcy.
Oh, okay. All right. Thanks, Katie.
Thank you. Sorry about that. Things are a little longer than we had planned on. Okay, so I'm going to go over a few questions. The first one is, could we get some instructions on the SL3 RFSs for July to October? I noticed there will not be a rate request for the SL3 codes. So are we able to submit those requests, or others for that matter, before July 1st, knowing that they can't be approved until July 1st? Obviously, we don't want to submit them right now because they would close out, but in a week or two. Do you have a preferred timeline? The answer is the preference is to submit the request as close to July 1st as possible so that the RFS committee is able to spend the next few weeks focused on processing the requests needed before closeout. Based on the volume of the submissions, we will add additional RFS meetings after July 1st to process the requests as quickly as possible. The next one is, can SCEs look up the clients? I think this one was answered, but can they look up all our clients to see what has been paid or not? Other services, not SCE payments. Currently, only provider payments are shown on the report. If that is something that would be useful, we can discuss it with the Youth Steps team about adding that capacity. Please reach out to dspdinfo@utah.gov if that is something that would be helpful. The provider questions about the billings and losing out on the billings, the answer was that we are obligated to follow Medicaid guidelines when it comes to billing dates, but every situation is unique when it comes to these billing issues. So please reach out to dspdinfo@utah.gov to discuss individual circumstances. I think it was already answered about linking housing vouchers to Youth Steps. At the billing, I don't know if Mel is still here or if you want to go over any more of the billing stuff. I think that we've covered that.
Yeah, I think we've covered those. And when it comes to the billing, we can only go by what Medicaid rules are. And paying those with state funds was not really part of the budget when we create the budget. So, but if they have any question, they can, I know we're out of time and they can easily just call me.
And did somebody put this last answer in the chat about a reference guide is the CMS instructions? Did we want that? You want to put that in the chat? But
I can put that in. See, I don't know. It's kind of very technical.
okay.
So I added that. If anyone wants a reference, they can reach out. This is Kristen. You can reach out to me. I can give you that reference. But it does get pretty technical. So
I see one more question about what is a number to call about the billing questions. Who would be best for them to call, Kristen?
they can either reach out to Mel or I, and you can find our numbers on the DSPD website. Just go under about and we have all of our phone numbers and email addresses, so you can reach out to either of them.
Okay, well, that was all that we had in the questions. Sorry for keeping you over a little bit. In conclusion, we're just glad that you're all here. Our next meeting will be on Thursday, September 7th. So watch for an invitation to that. And thank you so much for coming.